My name is George Shine, and I'm a technical director with the Advanced Consulting Group, part of the Nationwide Retirement Institute. A part of my role here at Nationwide is to consult with financial professionals to help them address unique and unusual circumstances that their clients may face. One example of this that comes immediately to mind is from a financial professional named Chip. Now, Chip has built up a large book of successful clients over the years, and it just so happens that many of them are clustered in their late 50s and early 60s. His clients are starting to ask him about Medicare and want to talk about how they will pay for healthcare in retirement. Now, Chip knows some basic information about Medicare eligibility and enrollment, but a recent meeting with a particular set of clients presented some challenging issues that he wanted my help with. His clients are Jerry and Chris, a couple who are both in their early 60s. In the past few months, Chris, an architect, began to notice his hands shaking when he was sketching at work. So I made an appointment with his doctor, who referred him to a neurologist. And Jerry, he has his own medical issues. He actually has had MS for most of his adult life. While it flares up from time to time, he is able to do most of the things he and Chris want to do without many issues. Both men realize that with age, their ability to get around may be compromised. So when Chris brought up the idea of meeting with Chip to reevaluate their finances, Jerry agreed that now would be the right time. On their way to meet with Chip, Jerry was reading over his notes from their last meeting and saw they could enroll in Medicare around their 65th birthdays, even though they were still working full-time in their respective careers. So they decided to ask more questions about what kind of healthcare coverage Medicare will provide. When they got to Chip's office, he reviewed several important pieces of information with them related to paying for healthcare and their approaching retirement years. First, Chip helped ease some of their concerns by reminding them that Chris had purchased a long-term care insurance policy a few years ago. So, in a scenario where Chris would one day need more support or care than he could take care of on his own, or with Jerry's help, his long-term care insurance policy could kick in. Next, they discussed Jerry's plans for addressing his own healthcare needs in retirement. Because his pre-existing MS had always prevented him from qualifying for long-term care coverage, he wanted to know what types of care Medicare would cover. Unfortunately, Chip had to explain to the men that Medicare does not generally cover long-term care or personal care services. On the other hand, he also pointed out that Medicare Part B does cover durable medical equipment, like a wheelchair, if it's prescribed by a doctor. So this fact was welcomed by Chris, who was thinking about a future where Jerry might spend more time using a wheelchair to get around. Jerry and Chris left the meeting with Chip feeling a bit better. While they were happy to be reminded about Chris's long-term care policy, they were still worried about being able to have the cash flow in retirement needed to pay for the care Jerry might eventually need for his MS, or anything else that might pop up. During the week or two after the meeting, a few more questions and concerns came to the two men, so they decided to call Chip back. It's at this point that Chip called me to help him plan in more detail for his follow-up meeting with his clients. Together, we were able to think through a number of different products and strategies that may help ensure that the couple will have a constant source of funds on hand as the years go by to better support high healthcare costs. For example, an annuity could perhaps provide a steady income stream for some of Jerry's healthcare costs, since he is likely not able to qualify for any long-term care policies. I also pointed out that there may be additional Medicare solutions that we don't know about, and encouraged Chip to recommend that the men reach out to their State Health Insurance Assistance Program office. SHIP employees in most states would generally be able to talk through complex situations and give advice on the plans that will meet as many needs as possible. We also recommended telling Chris and Jerry about the helpful resources from the National Council on Aging, or the NCOA, as well as general information on the Medicare.gov website. At Chip's subsequent meeting, the couple was very appreciative of the options presented to help plan for future healthcare costs, as well as the additional resources that they could look to for more information. The couple left the meeting feeling better than before. Now, the couple are focusing a bit on the layout of their current house and any changes that could support them both as they get older. In fact, Chris is already drawing up plans to make their house handicapped accessible while still trying to keep it as stylish as ever. Remember, Medicare does not cover everything, and in particular, it does not cover long-term care. Every state has a State Health Insurance Assistance Program, or SHIP office, an unbiased resource that can provide guidance to Medicare-eligible people who are making insurance decisions. Consider applying for a long-term care policy when you are younger and perhaps more likely to be healthy to potentially keep your premiums lower. If you qualify, long-term care insurance may cover a range of things, from assisted living facilities to home modifications, depending on the policy. For folks who can't get long-term care insurance, there may be other ways to provide for care. Your financial professional can help you strategize and make a plan.